Hello students, today we will discuss about the conceptual overview of pelvic organ. In this lecture, we will not discuss the individual pelvic organ, but we only discuss that what is the overview of these pelvic organs, how they are arranged in the pelvis, and what is the difference in the male and female pelvic section. Clear? So, if you will see the pelvis first, you should have this orientation before reading the pelvis or perineum, that how the pelvis, bony pelvis is formed and what are the basic bones. We will not discuss in the depth, but I will just give you the conceptual overview. So when you will see this part, what is this representing? Actually, when we will have the pelvis, it is made up of two hip bone on the sides and a sacrum on the posterior part. Now what we did is that I have removed one side of my hip bone. So that is the left hip bone has been removed in this diagram, and what you are able to see is my right sided hip bone with the sacroiliac joint of that area. So you can see that this is my right hip bone, this is the anterior superior iliac spine of the right side, and this is adjacent sacrum with that. Clear? Now what we are going to see is that why we did this, because we want to see the inner side of the pelvis and we will see the arrangement of the muscles and the organs. Clear? Now what you are able to appreciate here, that you know that there is a greater sciatic notch and there is a lesser sciatic notch. Now these two things are starting from this point is known as ischial spine. Now above the ischial spine you have the greater sciatic, and below the ischial spine you have the lesser sciatic notch. Now these two notches are converted into the respective foramina with the help of these ligaments. This is the sacrotuberous ligament. This ligament is connecting the tuberosity of the ischium to the sacrum. That's why this is known as sacrotuberous ligament. Then you have one horizontal ligament. Now this horizontal ligament is known as the ligament between the spinous process and the sacrum is known as sacrospinous ligament. Now with the help of this ligament, these two notch converted into the respective foramina, and now it is known as greater sciatic foramen, and this is known as lesser sciatic foramen. So when you will have the bony pelvis, the first thing which we will see here, that after removing this side of the bone, on the opposite side you are able to appreciate these two ligaments. Clear? Now what next we are going to see here, that how the other structures are arranged here. Clear? So when you will see the another slide, you are able to appreciate that there are two major muscles which are present in this section. Now what these major muscles comes here in this picture? Now this is the one muscle which is arising from your sacrum and going towards your gluteal region through this greater sciatic foramen, and this is the piriformis. Now here on this side where you will have the obturator foramen, we have a muscle, and this muscle is actually going through the lesser sciatic foramen, and this muscle is known as obturator internus. Clear? So there are two muscles which you are able to appreciate here. The first is known as piriformis and the second one is your obturator internus. Clear? Now after that, if you will see the further arrangement of the structure here, now this is your two muscles. Now this is how you have the another muscle. Now here you have to just concentrate on these two things, that here right now you are able to see the inner side of obturator internus, but in the next part what you are able to see is that on the obturator internus you have a tendinous arch. Now here there is a formation of a tendinous arch. So this is the important thing which you have to understand, that on the inner side of obturator fascia there is a presence of tendinous arch, and this tendinous arch will give rise to a muscle, and this muscle is your diaphragm of pelvis, and this is known as pelvic diaphragm. Clear? So what is the first and most important concept before start the reading of your pelvis? That pelvis is having a diaphragm is known as pelvic diaphragm, and this pelvic diaphragm is having origin from this tendinous arch, which is not on the bone but it is on your fascia, which is covering the obturator internus. Clear? Now what is the function of this pelvic diaphragm? Now when you will have the pelvis, you have this concept in your mind that we don't have any bone in the center of the pelvis. Clear? You have the circumference of the bones, but in the center we don't have anything. So what will happen that if the organs are present in the center, like uterus, like your urinary bladder, now if you will not have the support from lower side, those organs will sink down. So to provide the support from the lower side, you have a diaphragm is known as pelvic diaphragm. Clear? So now when you will see the different parts of this pelvic diaphragm, these are the different names which are given to the different parts of pelvic diaphragm. One is the iliococcygeus, pubococcygeus and puborectalis. These are actually the muscles of the pelvic diaphragm between the adjacent bones. Now this bone is ilium and it is going to the coccyx. So this is from the ilium to the coccyx. So this component is known as iliococcygeus. Now the component which is going from pubis to the coccygeus, now this is your pubococcygeus because this is the pubic bone. Then you will have puborectalis. Now this puborectalis is nothing but it is enclosing a aperture for the anal canal, and this is known as your puborectalis. Clear? Now there is a one more important thing which you have to understand here, that this pelvic diaphragm is having a large aperture in its anterior aspect. Now this large aperture which is present in its anterior aspect is known as urogenital hiatus. What is that? Urogenital hiatus. Now this urogenital hiatus is further supported from below by one more diaphragm, and that is known as urogenital diaphragm. Now we have seen this formation of the inner side, the muscles. So what till now you know that there is a pelvic bones. Now inside the pelvic bones you have first the obturator internus. Now on the inner side of obturator internus you have the tendinous arch. Now from the tendinous arch we have the origin of pelvic diaphragm muscles. Then in the pelvic diaphragm you have one aperture on the posterior side for the exit of anal canal. Anteriorly you have the aperture for the exit of urogenital diaphragm. Now in this area, if you have the orientation of the bladder, you will realize that bladder present in the anterior part of this pelvic cavity. This is your pubic bone. Now this bladder lies anteriorly in this part of the pelvic area, and this bladder is a pelvic organ when it is empty. But as the urine will go into the bladder, the distension will occur and the bladder will come out and it will become abdominal organ after distension. Clear? Apart from that, on the posterior side, if you will see, you have the space for the rectum. Now the another important thing which you are able to appreciate here, that this is your urethra. Now this urethra is passing through this pelvic diaphragm gap, and this pelvic diaphragm gap is known as urogenital hiatus. As the name itself suggesting, there are two components, uro and genital. Uro means that it will give pathway for the urethra, and genital means it will give pathway for the vaginal canal in case of female. Now here you can see that the urethra is going downward. Now below the urogenital hiatus, here you are able to see this additional plate. Now this additional plate is now known as urogenital diaphragm. What is that? Urogenital diaphragm. So this is the important thing which you have to understand, that in the pelvic region there are one complete diaphragm is there, that is known as this diaphragm, pelvic diaphragm, and below the pelvic diaphragm anteriorly you have additional layer of the muscle that is known as urogenital diaphragm. Now this diaphragm provides support to this big urogenital hiatus. If this hiatus is remain large, then there are always the chances that the organs may herniate through this big opening. So to close this big opening, you have one more support from the lower part, and that is your urogenital diaphragm. Clear? Now in this urogenital diaphragm, above the urogenital diaphragm, in case of the male, you have a very important gland, and that is known as prostate. Now this is your prostate. Now when you will see this gland lies above urogenital diaphragm. Now here you can see that it is now enclosing the urethra. This gland is known as prostate, enclosing the urethra in case of the male, and now this part of the urethra of male is known as prostatic urethra. Clear? So you have to understand this concept that we have a big gland, and this gland in the case of male lies below the urinary bladder but above the urogenital diaphragm, and it is present, or you can say in the lower part, supported by this part of pelvic diaphragm. So what is that? This is your prostate. Now after that you will realize that this is the portion which is piercing your urogenital diaphragm, and then it is entering into the penile portion of urethra. Now this urogenital diaphragm is having a lower thick membrane, and this is known as perineal membrane. Now the area which is below the perineal membrane is known as superficial perineal pouch, and the area which is above the perineal membrane is known as deep perineal pouch. Clear? So whenever you are reading the pelvis, you should have this orientation, that where you will find the urinary bladder. Answer is the urinary bladder present in the anterior part of the pelvis behind this pubic symphysis, and it is a organ of pelvis, but when you have the distension of the urinary bladder, at that time this will become abdominal organ. Clear? Now the second thing is that below the urinary bladder, in case of the male, you have the prostate, and this prostate lies inside the pelvic cavity above the urogenital diaphragm, and the part of the urethra passing through the prostate is known as prostatic urethra. Clear? Now when you will see the female pelvis, now in case of the female pelvis, you have the urinary bladder, and from the urinary bladder there is, as we know, there is no prostate. So what will happen? The length of urethra is also small, and this urethra here you can see that pierces the perineal membrane, and immediately it will enter into the superficial perineal pouch. Now apart from that, you have additional organ of the female here is the uterus, and it is having the vaginal canal. Clear? So what is the basic thing which you should know about the male female pelvis? That when you will have the female pelvis, you should have this orientation, that this uterus is also a pelvic organ, and the cervix will open into the vagina, and this is actually above your pelvic diaphragm. This area is also above the pelvic diaphragm, and the vagina pierces the urogenital hiatus at very low part, and here it is below supported by urogenital diaphragm. Clear? Now, when you will see the another organ in the pelvis, that is the rectum. Now, this rectum lies on the posterior part of this pelvis, and you should appreciate the very important thing is that it is not at all supported by this urogenital diaphragm, because this urogenital diaphragm is only support the urogenital hiatus. You have to understand this thing, that this urogenital diaphragm supports only the urogenital hiatus, not on the posterior part, that is the anal canal. Clear? And this anal canal will have a separate opening into the pelvic diaphragm, and this opening is known as anal hiatus, and through that your anus will have external opening. Clear? So, what are the basic difference in the male female urethra? So, when you will have the male urethra, you have the parts of the male urethra: pre-prostatic, prostatic, membranous part of the urethra, and spongy part or penile part of urethra. Now, what is the meaning of these names? The important thing is that when you will have this thickness of your urogenital diaphragm, now this portion of the urethra which is passing through the urogenital diaphragm is known as membranous part of the urethra. So, what is membranous part of urethra? Membranous part of urethra is the urethra which pierces the thickness of urogenital diaphragm, and then it pierces this perineal membrane, which is the lower covering of your urogenital diaphragm. Okay? And above that you have this prostatic part of the urethra, and this prostatic part of urethra is absent in the females. Now, when you will see the female, in the female case you have the urethra which is shorter in the length, and you will realize that this is the membranous part of the female urethra, because this is the segment which is piercing the urogenital diaphragm in case of the female, and then immediately it will open through the superficial perineal pouch. So, what are the differences in the male and female pelvis? Now, here first we will see in the male. So, in the case of the male, in pelvis you have only the two organ. Anteriorly you will have this urinary bladder, and posteriorly you have the rectum. Now, in between them you have a fold of peritoneum. Now, here you can trace, this is the fold of peritoneum. Now, this fold of peritoneum is covering the superior surface of the urinary bladder of the male, and then it is passing behind the urinary bladder. But the important thing which you have to understand, that this peritoneum is not reaching to the base. It is just covering the almost upper 1/3 of the bladder, and then it will reflect on the anterior surface of your rectum. Clear? But when you will see in case of the female, what you are able to appreciate, that here you have the three organs. It is urinary bladder, behind that you have the uterus, and then you have the rectum. Now, what is the reflection here? That this is the peritoneum from anterior abdominal wall covering the superior surface of your urinary bladder, but it is not going to the posterior side or even the posterior part of the superior surface. Then it will reflect on the uterus, and from the uterus it will go till the cervix and reflect on the rectum. Clear? Now, what is the difference? So, difference is that here in the pelvis in male you have a single pouch. You have a single pouch, and this pouch is between the urinary bladder and rectum. It is known as rectovesical pouch. What is that? Rectovesical pouch, and this is actually the lowermost part of greater sac. But when you will see the female, in female you are able to see the two pouches. The first pouch is anterior to the uterus and the another pouch is posterior to the uterus. Clear? Now this pouch is known as uterovesical pouch. Vesicle means something which is related to the urinary bladder, and this is known as uterovesical pouch. So where is the uterovesical pouch? It is the pouch which is between the uterus and urinary bladder. Now the pouch which is posterior to the uterus is known as rectouterine pouch. What is that? Rectouterine pouch. Now this rectouterine pouch is also known as pouch of Douglas. What is that? Pouch of Douglas, and it is present here on the posterior side of uterus. So when you will have the male and female pelvis, what is the conceptual thing which should always come in the mind? That in case of the male you have the urinary bladder, below the bladder you have the prostatic part, and the prostate is adherent to your urogenital diaphragm. Behind that you have the rectum, and we have a single pouch in case of the male pelvis, that is known as rectovesical pouch. But when you will see the female pelvis, you should have this idea that there is a pelvic diaphragm, and above the pelvic diaphragm in female we have the three organs: urinary bladder, uterus, along with the upper part of the vaginal canal and rectum. Now there are two pouches, one is anterior to the uterus, one is behind the uterus. The anterior one is known as uterovesical pouch and posterior one is known as rectouterine pouch or pouch of Douglas. Clear? So at the end of this class we are able to understand what is the overview of the pelvic organ, how the pelvic diaphragm is different from the urogenital diaphragm, and how the organs, particularly the differences in the male and female pelvis in the arrangement. So this is all for today's class. Thank you.